All right, guys. So Philadelphia American is going to be the number one competitor to Manhattan Life. Okay, so when we talked a few weeks ago about indemnity plans, the companies that sit at the top of the indemnity market are going to be Manhattan Life and Philadelphia American. That's up until recently, actually. Next week, we're going to train on a um, company called Med Mutual, which is rapidly um, claiming their place in the hierarchy when it comes to limited med. But for years it's been Manhattan Life and Philadelphia American. I was introduced to Philadelphia American in 2015. Actually, I um, I met an agency owner that was doing um, wellness programs uh, for large groups, right? And I went to their corporate office in Houston and I learned all about their wellness program. And it was a wellness program that was connected to insurance benefits and, had some tax advantages for the business and all this stuff, right? And so I'm learning about this wellness program. And then on the second day, there was an insurance carrier that came in, and the chief operating officer, Mary was her name. I can't remember her last name, but Mary, she's still the COO of Philly today. But she comes in and starts training us on the insurance products. And my market, as I've said, has always been the under 65 individual market, the health insurance market. And she makes the claim that we have the best limited med plan on the market. And I'm sitting there thinking, young guy, I'm like, that's what they all say, right? And I get back to my office in Chicago and I take a deeper look and I'm like, holy shit, they've got the best limited med on the market. And so that was when I really started to pay attention to Philadelphia American. And that was right before they made a very strong push in the under 65 individual space. It was almost like simultaneously when I heard that they were in the middle of building out their team that they were going to take to the under 65 market. And there was a good stretch there in the late teens, call it, right? Like 16, 17, 18, 19, even in the early 20s here, where Philadelphia American was the deal. Just recently, Manhattan Life revamped their plans and, in my opinion, kind of took over for that title of the best indemnity plan. But Philadelphia American still does a ton of business. There's a ton of value there, and they've built a really nice portfolio. So when you get contracted with Philadelphia American and you log in to your agent portal, this is what your dashboard is going to look like. Okay. And just like every other carrier, you've got your navigation board on the left to go where you want to go. I'll show you guys a couple of these things here that are going to be valuable to you. Obviously, the training library, right? Anytime you want to learn more about a specific product, you can come over to the training library here and open that up and find the product you want to learn about. And you've got a training on every single product here. It's all recorded for you. All right. Show you how to quote it, enroll it. Um, and so, when you log in, go do that. All right. Training over. Anyway, um, so I won't do that to you guys today. Um, so anyway, that's where you're going to find a lot of the different trainings, okay, for all the products, commission statements, different forms. If you have a downline of agents, you'll see your agent's production, all that stuff is going to be here, right? Where you're going to run quotes and enroll is going to be under where did it go? Online application. Okay, under online application, and the first button there is electronic enrollment platform. So you'll click on that, and you're going to see some boxes pop up here. Your completed apps, your incompleted apps, and your leads and quotes. The first thing you want to do when you're quoting somebody is you're going to want to add them as a lead. Okay, so you'll click on this box here and you want to add them as a lead. That way it's saved. All right, and I was kind of playing with it before, but so I'll click into myself again here. But to add it, you would click on this box and enter the information here. All right, and then hit the little green button there, save and quote. All right. Since I was doing that prior to the call, I'll just go ahead and open up what I was doing. All right, so there I am, Drew Scott. Open it up and continue to my quote. And now I've got my date of birth in there, my Florida zip code, and so the products are going to pop up that are available in my county in Florida. It may vary, a little bit depending on where you're selling, but it's as close to universal as you can get. There's a few different versions of their indemnity plan. Okay, as you can see here, these first few products are all indemnity plans. You got the Health Choice Select, the Health Savers Plus Gold, the Premier Health Savers Plan, the Optimum Health Savers Plan. These are all limited med plans. All right, all indemnity plans. And the best one is going to be the Health Savers Gold Plan. Okay, so I'll tell you, I just did an application earlier today, and I did the Health Savers Gold Plan. I still, to this day, when I sell Philadelphia American, I use the Health Savers Gold. Again, it's the best product. But I'm going to show you real quick just the main differences when you look at the Health Choice versus the Health Savers. So we'll start with the Health Choice. And as you can see here, I'm not going to open the brochure on this. I'll open the brochure on the gold plan. But when you are running a quote, you're going to choose 3 different benefit levels. Okay. You're going to choose the annual maximum. You got 100 grand, 250 and a million. You're going to choose the units. And what the units refer to is the level of the policy. Okay. So the benefit level of the policy. Each indemnity plan is going to have 3 units, okay, or 3 levels, and they break them down into units. Now, unit 1 is going to be the lowest level of benefits available, and unit 3 is going to be the highest level of benefits available. And then the first day hospital confinement percentage. So, what that means is on the first day that somebody is hospitalized, what percentage of the inpatient benefit are they going to get? So let's say you choose a policy that is $2,000 a day worth of coverage in the hospital, but you pick this 20% here. Okay. That means that they're going to get 20% of the $2,000 benefit on day 1. All right. They'll get 100% on day 2 and beyond, but they're just going to get 20% of that on day 1. The reason they do that is, obviously it's going to be a pretty significant savings on what am I missing here? I got to pick an effective date. Can you pick an effective date here? It's going to be a pretty significant savings if I give 100% of that benefit on day 1 versus 20% of that benefit on day 1. So you'll see the difference there, right? If I go with a health choice plan, $250,000 annual, 2 units, 100% of the hospitalization benefit on day 1 is going to be $264 a month. But if I go 20% of that hospitalization benefit on day 1, it's going to be $158. All right. And now the health choice plan has no deductible. Okay. There's no deductible on the health choice plan, just like the Manhattan plan, right? 0 deductible. Okay. But that's it. That's all I'm going to show you on the health choice. All right. So the health choice plan, 0 deductible. 3 different calendar year max, 3 different calendar year max benefits, and then one, two or three units. If you want to learn more about that, you can run that quote and the brochures. You can always open them up right here. Okay, so open up the brochure, and I'll just show you real quick the different levels to the policy. So, but we're not going to spend a lot of time at all on the health choice. We're going to dive into the Health Savers Gold plan. But here's the benefit levels. So that's the benefit right there, the inpatient benefit that I was talking about for what you're going to choose the percentage of on the first day, right? So if we had the 2-unit plan that we quoted and somebody's hospitalized for a sickness and we got the 20% of the first day benefit, they're going to have a $600 benefit on that first day. And so you can see obviously how that's going to affect the premium quite a bit. All right. So let's go back to the quote. And let's close the health choice and let's go to the Health Savers Gold plan. The Health Savers Gold plan is the king of products when it comes to Philadelphia American. Okay. Same thing. You're choosing 3 different benefit options. When you're running a quote, you're going to choose the calendar year maximum. You're going to choose the deductible. Okay. So a little different than choosing the percentage of benefit on the first day of hospitalization. You're going to choose the deductible. It's a confinement deductible, and I'll elaborate on that a little bit when we open up the brochure here. And then you're going to choose the units, right? So similar to, same thing as the health choice, you got 3 units, 1, 2, or 3 units. Here is our gold plan brochure. Okay. Here's our gold plan brochure. And I want to touch on that deductible for a moment because remember, it's a confinement deductible. Okay, so what does a confinement deductible mean? The deductible is only relevant if somebody is hospitalized. Okay, so notice where it says on the brochure here, deductible applies, and you got a little check mark for this and a check mark for this. Well, this first line item is hospitalization. Okay. And the second line item is ICU, which is obviously hospitalization as well. All right. So the deductible on the plan is only relevant if a policyholder is hospitalized. Okay. So you'll choose the deductible. All right. When you're running a quote, and I always go with the 5,000 because again, it's only if they're hospitalized. And there's also an admission benefit. All right, for a deductible of 2,500 or higher. So what is an admission benefit? Upon being admitted into the hospital, the plan is going to pay a benefit towards the deductible. All right. So, if we go with a $5,000 deductible and we get a $2,000 admission benefit, then really only the first $3,000 is the policyholder's financial responsibility. All right. Which I know what you're probably thinking because every single client that I've ever pitched this plan to has said the same thing. They said, well, why don't they just call it a $3,000 deductible? I don't know. The actuaries got together and said, hey, let's price it out like this. We'll do a higher deductible and we'll give you an admission benefit, right? Let's make it as confusing as we can for the clients. So that's what they did. So you got a deductible and an admission benefit. All right. And then you get into your 1, 2, or 3 units. All right. I sell mostly 2 units. Okay. If I've noticed that at the 2 units, you're covering your clients pretty well. All right. 3 units is obviously better, but at 2 units, you're covering them pretty well. All right. So again, that first line item there is going to be per day inpatient coverage. Okay. 3,000 for a sickness, 4,500 for an injury. ICU plan will pay up to 20 days in the ICU, 4,500 for a sickness per day, 5,000 for an injury. Now, if you're in the ICU for 21 days, the plan doesn't just stop paying, it just refers back to the typical inpatient benefit. Okay, so you only get that extra bump in coverage for the first 20 days in the ICU. All right. Um, Rehab facility, inpatient. Okay. Rehab facility, skilled nursing. Okay. So actual, like, body rehab, not drug rehab. Um, Surgery center. Okay. Surgery center. That's a great benefit for a surgery center. Okay. For someone who's going to have a surgery, an outpatient surgery, you get a $3,500 facility fee benefit. That's if you're under anesthesia, $1,500 benefit if you're not. All right. And most surgeries, they put you out. Even an outpatient surgery, they're going to put you out for a couple hours. All right. Outpatient radiation chemotherapy benefit. Okay. So again, I won't go line by line. We kind of, we went through the Manhattan brochure and kind of showed you all the benefits, but this is where you're going to find the list of the coverages for everything. Doctor's visits. This is what's really nice about this plan. This is one of the things that is very intriguing to prospects, right? Is the amount of doctor visits that are covered. So if you remember on the Manhattan plan, they're going to cover 10 doctor visits per year per person. This policy is going to pay 20 doctor visits per year per person. Okay. Up to 6 of those can be used for the chiropractor. All right. And then the first 2 specialist visits, you get a little extra benefit. Okay. So if you got the 2 units, you get $120 per doctor visit. And then the first 2 specialist visits, you get $150. Now, again, you can go to a third specialist visit, but you're going to get the $120 as opposed to the $150. All right. So again, here's all the different outpatient diagnostics, emergency room. If you guys remember with the Manhattan plan on the emergency room, that's where the gap is, right? This is how you're going to add supplemental policies. Okay. When you're talking about the emergency room, everything is more expensive in the emergency room. Okay. A $300 benefit to the emergency room isn't going to cover spit. All right. Not in the ER. In the urgent care, it will. Okay. An urgent care visit is, typically about $150. But the emergency room is, I just had a client call me the other day, got a $13,000 bill. They were in the ER for about 2 hours, right? And unfortunately, they went there because it was, my client was sick. It wasn't an injury, right? Because remember, I'll add in that accident plan for when the emergency room can't be avoided, right? For the outpatient accident or injury. But in this case, client was sick, so they've got the coverage on the policy. They've got the coverage on their indemnity plan, and that's it, right? Now they've got this bill. And so what we're going to do is we're going to turn that bill over to the advocacy team, and we're going to have the advocacy team negotiate that bill down. Okay. So, but that's how you're going to get those supplemental plans in there. Okay. So the Health Savers Gold plan is going to be your go-to. Okay. When it comes to Philadelphia American, 20 doctor visits, $1 million, calendar year, assuming that's what you choose. Deductible is just for inpatient, and you can go lower. You can go $500,000. Okay. I don't usually go much lower than that. I'll tell you, after 20 years of being in this business, the most I've had a client rack up in bills is just shy of $500,000. It was like $480,000. Okay. Now, does it happen where people get billed over $500,000? Yes. I just haven't had that experience. And so when I talk to a client and I say, I'm comfortable giving you $500,000 worth of coverage annually. All right. That's just coming from experience. Okay. But if you want to go $1 million, go $1 million. All right. You're going to get the quote and you'll see the price difference for all of them. Okay. Let's say we're going to go with $500,000. So we're going to pick this policy for this 43-year-old gentleman in South Florida, $176. Okay. Now we've got that in our cart. All right. Remember, we're going to add the supplements. Okay. We've got accident plan, 1 unit, 2 units. That's all I worry about when I'm selling this accident plan. Okay. Now, if you want to add, disability income, you want to add accidental death, you can certainly add some riders onto this accident plan. I'm just selling the accident plan specifically for some extra accident coverage when the client, has an injury and they're not thinking about the bill that they're going to get. They just have to go to the emergency room and quick, right? And I don't want them to get hammered with that giant bill. All right. And so I'm going to add this 2-unit accident plan. Now, 1 unit is going to be $2,000 worth of accident. 2 units is going to be $4,000 worth of accident coverage. Okay. So I'm going to add the 2 units. But if you guys remember our training a couple weeks ago on Allstate, the accident plan with Allstate is significantly less expensive, right? But when I'm sending a quote to a prospect, I'm going to send it with one carrier, right? So I might send this quote to a prospect, okay? The Health Savers Gold plan with the $4,000 accident plan, knowing in my mind that I can get you a better accident plan with Allstate. But the first thing I'm going to do is I'm going to close you on this deal. All right. I'm going to close the prospect on this deal, and I'm going to get the buy-in that they understand why that extra supplemental plan is in there, why that extra accident coverage is in there. Once I have that buy-in, then I might say, you know what, Mr. Jones, this is $31 for $4,000 worth of accident. Why don't you let me see if I can find you some more accident coverage for that $31? And I'll take that quote over to Allstate, and I'll
All
probably
right,
find,
so I'm going through the sales and closing cycle, life cycle. One,
so once I get them bought in, I'll take that quote over to Allstate and I'll get them, say, a $10,000 accident plan for the $31, right? They know why I'm adding the accident plan, and now they're going to be, they're going to be thrilled that, that I was able to get them more accident coverage. Okay. But let's say we're closing this deal here. Okay. 207. We're going to close this deal. So one more thing I want to show you guys. There's critical illness coverage here up to $50,000, 10, 20, 30, 40, 50. All right. You can slap $50,000 critical in there or $30,000 critical in there. Good rule of thumb with critical illness, get 3 months worth of living expenses for the breadwinner. All right. 3 months worth of living expenses for the breadwinner. If Mr. Jones makes 10 grand a month and he's the breadwinner, sell him on $30,000 critical illness. Mr. Jones, if you can't work, is your family's income, is your household income going to be affected? Well, yeah. Well, what's going to take you out of work? Heart attack take you out of work? Cancer take you out of work? Right? Would you rather I send you a get well soon card or a check for $30,000? Okay. So we're going to slide that $30,000 critical illness in there. All right. And then the specified disease policy. Okay. The specified disease policy is an umbrella policy. Okay. That will sit on top of the indemnity plan. Okay. So I'm not going to go into this in too much depth right now. When we train on Med Mutual next week, Med Mutual's got a real nice specified disease policy. We're going to talk about it in greater detail. But there is a specified disease policy available here with Philadelphia American, and actually Manhattan has that rider available as well. All right. So what a specified disease policy does is it gives you get a higher, calendar year maximum, 50,000, 100,000, 250. So let's say I'm going to add an extra 250 in coverage on top of my 500, right? And it's going to be a $50,000 deductible plan. So once you rack up $50,000 in bills for a specific illness, this policy would kick in up to 250, right? So it's that extra, it's not major medical, but it gives you that extra major medical feel, right? So that's what a specified disease plan does. All right, but we're going to sell a Health Savers Gold plan here with an accident plan with $30,000 worth of critical illness. All right, we're going to cover this 43-year-old gentleman pretty solid for $245 a month. All right. Um, from there, we are going to click on continue. Okay, and it's going to show us our quote. When you send the quote to your client, this is how it's going to look in their inbox too, just so you know. Okay. When you send them the quote, if I were to send them the email directly from the portal, this is what they're going to pull up. Okay. And then you can see they've got the option to click on brochure and look at the critical illness. They can click on this brochure and look at the indemnity policy benefits and so on, right? But this is how it's going to look, um, when they open up their quote on their end. Okay. But we're going to go ahead and enroll this client right now. So show you guys the application.
And Drew, while that's populating, these are because these are indemnity plans, it's basically there's no network, right? It's just you submit your bill and they say, here's your money back kind of situation.
I'm glad you brought that up. Actually, there is a network,
Oh, then
and
I was wrong, Netra. Sorry.
it's the it's the First Health Network, so it works the same exact way as as Manhattan, where if you go to a doctor that's in the network, then you can show your insurance card and it will work exactly like traditional insurance, where the doctor will go ahead and they'll bill the insurance company, and the insurance company will pay, the benefit amount. And in most cases, it's just they're not, you're not going to owe anything, and there's not going to be any excess indemnity because the doctor is going to submit the bill for pretty much, um, however much the benefit exists, right? However much the insurance company is willing to pay, that's how much the doctor is going to submit the bill for, right? So it can work like that. Or if there's a doctor that you really want to see that's not in the First Health Network, policyholder can see that doctor and they can pay cash, okay, and then submit their bill, submit their receipt to Philadelphia American. They'll get a back office portal, right? And they can upload it directly and then have the benefit reimbursed. Okay. So there is a network. And if they go to a doctor that's in the network, then it will work very similar to, how traditional insurance operates. But it's nice because they can go anywhere else they want, anywhere out of network as well, and still get the benefits. Okay. So 50-50 of that was accurate, actually. All right,
Yeah,
so here's
close
what the
enough.
application, yeah, close enough, exactly. Here's the application. All right, put my office address in. Okay. Electronic consent, email or email and text. Got to put an email in there to be able to choose that. It's telling me that's not an address in Cape Coral, and they're right.
Yeah, you have to uncheck the email, no email address.
Hmm. Email and text, or just email. Social, birth state. Not putting my real social in there. Height and weight. Weight's actually coming down a little bit these days.
Proud of you.
Yeah, gotta keep it going. I want to get under 200. I was under 200 when I got married 12 years ago. I want to be under 200.
I miss the 200s. It's a
I
good
know.
time.
Occupation. I'm a pesky sales guy. Do they have sales in here? insurance, whatever. I'm a woodworker.
So are
Beneficiary.
these like knockout questions too, basically, as you go
Yeah.
through?
Yep. And there's also rate ups, right? So you can be rated up when there's underwriting guides, and if somebody's taken let's say insulin diabetes is going to be a knockout right away, but if they're taking metformin, they could still get in. Okay. But metformin would be a rate up, a 1 point rate up. Okay. Now, if they're taking metformin and cholesterol medication, then they would have a 2 point rate up. And where you put that in is on the quote right next to the tobacco question. And I passed that. I just blew right by that. So I apologize. So on the quote next to the tobacco question, it's going to ask you, it'll say points, right? Which means rate up points. And you can rate up 1 point, 2 points, right? Based on medication. So if somebody is on the border of the build chart and they've got they're taking metformin, cholesterol, and high blood pressure, they're probably going to be a knockout. All right. Because once you get to 3 point rate up, you're playing with fire. All right. Toya Ellefson, that's wifey. She's going to be my beneficiary. If God forbid something happens to me, and there are benefits that are due to be paid out, go to my spouse. Okay. And in the past 12 months, have you done any hazardous sports? No. All I do is work and cart my kids around. Um, currently under any treatment for drug abuse or alcohol? No. Full-time student? They're all going to be no, right? For you to keep moving forward. Are we replacing insurance? No. Do we have anything else in place? No. I'm going to make this beneficiary apply to all of them. You're going to have 3 sets of questions because technically we've got 3 applications, right? 3 different policies that we're packaging in. Okay. I think this is the gold plan itself. All right. So has anybody tested positive for, taken medication for, been treated for, liver cirrhosis, hepatitis B? I don't need to read this to you guys. You'll read this to your client, right? And they'll tell you no. These are knockouts. Any of these questions are yes, it's a dead deal. All right. Past 10
Stupid,
years, AIDS.
stupid question, Drew, but how are they going to prove it? If you say no's and one's actually a yes.
Well, they'll likely catch it in the underwriting process, right? So the underwriting process is going to be they'll check the MIB report, right, where they'll likely find it, but then they'll also do a script search. So they're going to look at the prescription history.
Because people are going to try and get one past the goalie, right?
It happens.
Yep.
Yep, it happens. Or I love when clients get me to this right here where they're like, yeah, I'm healthy, everything's healthy. And then I get to the application and they're like, yeah, well, I got a little diabetes, or, I've got, you know, yeah, I've been hospitalized for drugs and alcohol, but I'm good now.
I'm
And I was
healthy
like, oh,
now.
yeah, I'm healthy now. Everything's good now. Okay. How long ago was that? Oh, about 6 weeks ago. Oh, okay.
Wow.
So
Yep.
yeah, they'll work on getting them through. Guys, everything we've gone through to this point, right? All the products, Manhattan, Philly, MedMutual, LifeX, these are going to be for healthy people, right? That's the target. And regardless of whether somebody gets a subsidy or not, there's this very strong argument to be made as to why the private health insurance plans are better coverage than the marketplace plans. Okay. Because at the end of the day, health insurance um, can be defined as simple as access to care. I mean, that's what health insurance is, right? Health insurance is going to give you access to care. And any one of these plans that I just mentioned outside of the marketplace are going to give you far more access to care than any of the marketplace plans. Okay. When you're on a marketplace plan, most of the time it's going to be an HMO policy, and you're going to have a very restricted network of where you can go. All right. Any one of these policies that we're talking about the last few weeks are nationwide PPOs, right? Or again, even if you go outside of the PPO, you're still going to get the benefits, right? So there's a really strong argument to sell these policies, right? When we're talking about, what health insurance is. But if somebody has any of the pre-existing conditions we're talking about, right? They take insulin, they have had anything to do with the heart ever, cancer in the last 5 to 10 years, alcoholic, was treated for alcoholism or drug abuse in the past, 3 years, MS, right? COPD, anything like that, you're going to have to go to the marketplace with those plans. Okay. Are there guaranteed issue policies outside of the marketplace? Yes, but they're not worth the paper that they're printed on. Any guaranteed issue policy will accept somebody, but they're not going to cover, in most cases, they're not going to cover any pre-existings, right? So they may say, yeah, we'll insure you for anything that's not related to your pre-existing. Well, believe me when I tell you, somebody that has a pre-existing condition, that's what they want insurance for, right? They want those conditions covered. Okay. So take them to the marketplace 100% of the time. All right. But there's also a very large market of people that are relatively healthy that are going to find a lot of value in policies like this. So you'll go through the questions. This is one of the longer applications in terms of health questions that you'll go through. But I also tell people that this is a positive. I view this as a positive because Philadelphia American does their underwriting up front. Okay. What does that mean? There's two different types of underwriting. There's fully underwritten, which doesn't meet the same definition as it does in life insurance, right? Nobody's going to come out and collect blood and urine. But fully underwritten is just where they're going to do more of their due diligence up front before they issue the policy. Okay. And then there's simplified issue where the policy is going to be issued as long as all the health questions are answered no, but then the underwriting is going to be done at the time of claim. Okay. And those policies are nice, right? To use, Phil's analogy of getting past the goalie, those policies are nice because you can get somebody past the goalie on those policies. But when something happens, the claim is likely not going to be paid, right? Because they're going to say, oh, you lied on your application, right? And I actually had that happen. I had a guy who, and he stayed with me, he's still my client. He actually had a policy for like 2 or 3 years. And then all of a sudden, it was determined that he lied on the application. And, I had to give a statement, and they gave 100% of his premiums back, 100% of his premiums back, and dropped him from the plan. The furthest that Philadelphia American will go with the underwriting is a phone interview. Okay. So you're going to ask your client, what's the best time to call? All right. If they want to do a phone interview with you. Okay. Then you go to the next page. God, they actually mirror the birth date and the social, huh? Ugh, they're killing me. How do they know all this?
It's insurance. They know all.
Let's see if they catch that domain. Brand new domain. All right, where did I mess it down? Oh, of course. Anyway, so you guys, the next page, which is telling me the page is unresponsive right now. See if we can get to the next page. The next page is where you're going to add billing info. All right. You'll add the billing info and then you'll submit it. You're going to put a little agent statement in. And you'll submit it. Your client will have to do a, here you go, billing info, routing, bank, account, right? Get the date they want, the first policy, you want to draft it upon approval or on the effective date. Most clients are probably going to say effective date, but you'll get paid when the first premium is paid. And then you'll do a quick review with them. You're going to click on each one of these and just say, just so you understand, you've got, 3 policies bundled together to create our one rockstar package of health insurance, and boom, 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 right? And then you'll continue and you'll submit it from there. All right. It's a done deal from there. They're going to get a signature page. Okay. An email to do their signature. All right. Put their John Hancock on it. And they'll have to do 3 of them, right? They've got to do it for each policy. Okay. So you can help walk them through that, but it's instant. They get the email instantly. So, stay on the phone with them and walk them through it. It's pretty self-explanatory, right? I know you guys will be just fine doing it because, putting the signatures to life insurance applications is a hell of a lot more confusing than this, I think. All right. So that's the application. Remember when you're selling this, always include the additional advocacy fee, right? The $12 for an individual, the 18 for a couple, and the 24 for a family. Gonna be so important, especially with policies like this, because if you know that an MRI is covered with a $500 benefit, you want to educate your client to go to the imaging center where the MRI is going to cost $500 or less, right? And if they don't know how to find that imaging center, because we don't want them to have a a homework assignment each time they want to do their insurance, all they have to do is contact the advocacy team. All right. Tell the advocacy team, hey, I need to have an MRI. Here's my zip code. Here's my insurance policy. Right. Where should I go? Okay. And so, keep in mind that advocacy membership is, something that you want to include with every single thing that you do, because it's going to make your life a hell of a lot easier, especially when your book of business grows with these health clients, right? You get up to having 20, 30, 100 health clients. You're going to love the fact that you have somebody you can pass that service work on to. Okay. What else about Philadelphia American? Philadelphia American Teledoc is free, right? Let's see here.
Do they need a social or some valid immigration status? What's their take on that?
Yep, they will need a social security number to apply. Yep.
Okay, so no ITINs or H-1Bs. It has to be a U.S. citizen.
Well, they don't have to be a citizen, but they do have to have a social, right?
Okay, so
So,
not sure. Does that answer your question?
Yes, thank you. It
Yep.
does. Thank you.
Good.
um, guys, script save prescription benefits. The prescription benefits are always going to be a reimbursement. Okay, so I just want to throw that out there. I get that question a lot. So you see that there's, on level 2, a $20 benefit for generics, a $40 for a brand name. The pharmacist is not going to submit that to the insurance company. They're going to pay for the prescription at the counter, usually using a discount card. They'll get a discount card with this plan, but GoodRx, kind of same thing, works just as well. So they'll pay for the prescription with the discount card, and then they'll submit the receipt for the $20 or $40 reimbursement. If you have somebody that gets a, kind of getting outside of the box here now, but if you have somebody that's prescribed a brand name that doesn't have a generic available and the drug is, 500, 1,200, $2,000 a month, we do have, the opportunity to work with those folks and save them some money on that prescription. Okay. We work with prescription vendors that can obtain drugs from other countries overseas, exact same drug for significantly less than what the pharmacies here in the States charge. So if you come across that, right, there's really not anybody that we can't help. All right. So when you come into these types of situations, reach out to Joe Moranto. I'm going to put his information in the chat for you guys. Joe Moranto is your go-to for all the nuts and bolts that you guys need support with. All right. When it comes to health insurance. Okay. This guy's been doing it for a long time. He is a pro when it comes to not just the off exchange plans, but the marketplace plans as well. Joanne, BMT, running quotes, answering underwriting questions, assisting with, some of those tougher cases. Reach out to Joe, even if you don't, have anything for him to work on, give him a call. He's licking his chops to get to work. So give him a call, introduce yourself, and let him know that once you have some work for him, you'll be calling him. Shoot him a text or an email. But he's available, guys. This guy is he's a workhorse. So he wants to be on the phone and he wants to be helping agents. But that's pretty much it, guys. The comps on Philly are fantastic. Get contracted if you haven't already. They do have appointment fees in some states to get appointed. Most states a lot of them are free. Some are, $5-10. I think Florida is a little bit on the pricey side. Florida might be $60, but if you're going to be doing business here, obviously, you got to pay to play. But you arm yourself with the products we're talking about, you guys are going to be lethal. I mean, there's nothing that there's nobody you won't be able to help when, you find somebody that needs to be covered with their health insurance, and there's nobody that you won't be able to compete with. Okay. So Manhattan, Philadelphia American, Allstate, LifeX, Med Mutual. And then obviously we'll be talking more and more about ACA in the next month or so here. So get contracted with these carriers and go back and watch these trainings as much as you need to, and then go into these training, utilize these, resources that all these carriers have available for you, right? Watch some of these trainings. They're obviously going to go in much more detail than I do, right, on these products, and you're gonna be able to pull a lot of different nuggets out of these trainings that you can use when presenting. All right.
Hey, Drew. I'm a new here. Actually, I joined late as well. So question about this is purely health insurance for everybody, um, or a specific group. If a person has a pre-existing condition, they can apply as well.
No, no, you're going to want to, again, depending on the pre-existing condition, but I assume you mean like something significant. I
Yeah.
mean, if the pre-existing condition is just high blood pressure,
Mhm.
you can get them on this. But if
What
it's
about
some,
the diabetic type 2?
is that insulin? Type 2 is insulin,
Yeah,
right?
yeah.
Yeah, no, no, get them on the marketplace.
Okay.
Get them on the
Uh,
marketplace. So anybody that's got anything, going on like that, or has had anything with the heart in the past, or any cancers in the past, get them on the marketplace. Nothing is going to cover them, um, the way that they need to be covered, like the marketplace will.
okay. And what about the income? Does they need any income requirement? Like, do they check any income?
No, nope,
No. So this
not for
basically
these
is a
plans.
fair. This program is fairly people who are healthy and no pre-existing condition, and then they
Can't
need
afford
health
it.
insurance, affordable, right?
Yep, yep, that's
Okay.
exactly right.
And they approve in New Jersey too, right? I can write in New Jersey.
I don't believe they're available in New Jersey. No. So if you're
Oh,
in New Jersey
Manhattan.
selling in New Jersey,
Is
um,
Manhattan in New Jersey? Fairly
I
similar
don't
setup.
I don't know if Manhattan is in New Jersey. I know LifeX is.
Yeah,
I
and
got I
Um,
got got from Philip yesterday, but this is something new for me. So yeah.
yeah. Well, let's see here real quick. There should be a product availability chart here somewhere. Product availability. There we go. Under 65. Okay. Health Savers, Gold. Where are we at? New Jersey. I don't see it. Nope.
I don't see it.
Nebraska,
No.
Nevada, North Carolina. Nope. No New Jersey.
Okay. Thank you.
Are you licensed in any other states?
Yeah. New Jersey and North Carolina, South Carolina,
Very good.
Texas.
Those are great states. Yeah, all three of those are great states.
Mhm. Yeah.
you just got to move, Jignesh. I mean, no one lives in New Jersey, right?
Yeah. Yeah. I mean that's what I'm thinking about.
Yeah, you'll save a lot of money going to the Carolinas for sure. Even
Big,
Yeah.
Texas.
Right.
big
Yeah.
time. Um, that's awesome. Any other questions, guys? We got like 2 minutes. So I'll just throw in there too, if you guys are getting the newsletter, inside the newsletter, there's contracting links for Messer, for the ACA and Medicare. There's contracting links for Compass, which we do LifeX and Iron Health. And then there's a contract for the ancillaries. So I put the link in the chat as well. So if it's easier for you to get there, as well as VCare. So all of those are different verticals inside of the health space, because health is still the Wild West, in my opinion, compared to life insurance. They're still figuring out their way. Very lucrative, obviously, but there's different contracting for different things. So go look at the newsletter if you saw it, or for the specific ones in here. I have the one for enrollment inside of the ancillaries, including Philadelphia and VCare, which Drew mentioned too. Not sure your question, is there any charge to get contracted? I think you said it was state-based, Drew.
Yeah, there's gonna be some states that do have appointment fees.
Like 10, $15, something like that.
Yeah, that's gonna be the average, 5 to 15, somewhere in there. Florida's gonna be a little bit more, but Florida's the most expensive.
So,
Have one more question.
what's up?
So, like the previous uh, webinars, like Mutual of like Manhattan and previous Med Mutual, I already have contracted with those companies with some other place through Medicare because I do Medicare. I already have those. But if I wanted to transfer the contracts under you guys, is it possible?
Should be.
Well, the under 65 contracts are separate from the over 65
Yes,
contracts.
definitely. But I do have all this, whatever last few weeks you are talking about. I do have already appointment and contracted, which I sell. But is it still possible I can convert, change? That's my
Yeah,
question.
yeah, you probably need a release, but yeah, you could change it.
I can. Awesome, awesome. Thank you.
All right. Any other questions, guys? You got the expert here. So,
One more. Sorry.
you're fine.
I have so many of my clients who do not qualify for ACA and they're looking for private plan, but they're asking for United Choice Network. So I have been through this first health network. Some of them are not liking it. They are having a hard time to find the doctors. So if later on, if you have any company who offers United Choice Network, I know UH1 does, but if there is anyone else, we can talk about it later.
Yeah, that's gonna be the only carrier that's gonna offer that network. But we've got a
Okay.
UH1 contract too.
Yeah. Okay. Perfect. Thank you.
All right, guys. We've hit the 5 o'clock mark. This will be up on the tube later. Who do we got next week, Drew?
Med Mutual.
Med Mutual. All right, guys. Have a great rest of your day, and we will talk soon.
Thanks, guys.
See ya.